Good afternoon. It's July 23rd, 2024. Our patient is having facet joint pain in her neck on the right side. We call it cervical facet joint pain. And the pain is coming from the small joints in the back of the neck. We're going to show you what I'm talking about in just a moment. Henry will show us an animation. We're going to go in and destroy the pain nerves so that she doesn't have that pain anymore. Okay, shot. First we need to localize. All right, so we got 2, 3, 4, 5, 6, 7, T1. So T1, 7, 6, 5, 4, 3, 2. All right, very good. That looks good to me. I had her marker pain before surgery. So we're going to go in and deaden the pain nerves on the right side of the neck. She does not have facet pain on the left side. We start the surgery with a 4 millimeter incision. 4 millimeters is tiny in the back of the neck. That's what I just made, is that incision. And blood pressure is good.
Yep, 92/60.
All right. Very good. All right, Dr. B, we are going to head down. Now, Henry, why don't you show our audience how this procedure works? She's facing down, correct? Straight down? Perfect. She looks like she's turned. Well, a little bit. It's not much. If you can just help me straighten her out. Because look at Jordan's x-ray. You can see the spinous process at the bottom is midline, but then at the top it's to the side. Henry, go ahead and show our audience how the facet joint how the facet joint causes pain. Yeah, she still looks a little rotated. Maybe it's Jordan's fluoro. Yeah, your fluoro is a little. Okay, you can see from our video that facet joints become damaged, then they end up causing pain through a process called inflammation. And it turns out inflammation is the cause of pain in every human being for lots of conditions. Some of the more famous conditions include arthritis, osteoarthritis, or rheumatoid arthritis. Both of them are forms of inflammation in the joints. Okay, we are now over the first joint, which is C4. I'm going to start with 4 because her pain is a little higher, and I got her permission to treat what needs to be treated. I want to make sure we get rid of this pain. And I'm just about in the perfect spot where the pain nerve is. Jordan, you want to show the audience where that pain nerve is? It's right here, right where I'm deadening. That's it. Shot. Yep, right exactly where I'm at, folks. It's a perfect spot. Just got done with one. We're going to move down to the next one.
We have a question.
Certainly. Shot.
Coming from Brad on YouTube.
Brad, good afternoon. Sorry, we've done 2 surgeries already today. This is our first broadcast surgery, and the reason we didn't broadcast the other 2, the first patient did not want to be broadcasted. He's from Miami and the Keys, and he said no, so we didn't broadcast his surgery. And then the second patient was done in another room that we don't have a camera. So this is actually our first live stream today, and we appreciate you guys joining us. Yes, I'll take the question.
Of course, coming from Brad on YouTube, asking, do the cervical median branch nerves also innervate the cervical multifidus muscles?
Multifidus muscles.
Multifidus muscles, excuse me.
No problem. No, they don't. No, they don't. The medial branch of the dorsal ramus nerve that we are destroying is only a sensory nerve and innervates only the facet joints. There is another nerve that comes off the same part of the main root that continues to innervate the muscles, and there's another branch that goes back to the skin. But the nerve that we're destroying right here at the waist, it's called the waist of the lateral mass, is just a sensory nerve, and there's no motor fibers. So to innervate a muscle, you have to have motor fibers or muscle fibers that go to the muscle. And this patient, where we're burning the nerve, is just sensory. All right. Just about done with this procedure. And then we're going to move to the Deuk laser disc repair. Do you see the location of that tip? That is literally as perfect as it gets. And what's interesting is she, unlike so many of our patients, she doesn't have much arthritis of like hypertrophy of the facet joint where you see bone spurs. Her facet joints are pretty clean. However, they are very painful, and she has horrible pain with rotation. So she's an interesting case. She's young, very healthy, but she does not have much of the bone spurs that we typically see with this condition. Probably because she is so young. And the injury is more recent. Shot? Uh-huh. Just have one more to go and we're done. Shot? All right, it's looking good. Just about there. Shot? Uh-huh. Any other questions?
At this moment, no current questions.
Wonderful. So we're pretty much done here. I could feel the nerves, the pain nerves get severed, which means cut. We've lost about 2 mils of blood, 2 cc's. Let me show you the incision. It's tiny. Look at this. Can you see this, Henry?
Yes, we can.
So you guys see that incision right there? It's tiny.
Yes, we do.
All right. And that should heal up quick, within just a day or two. All right. Any other questions? If not, we're going to end the live stream. We're going to come back with her anterior cervical. She's getting a disc fixed as well. So we're fixing the facet pain and her disc pain. I'm just putting one little staple there. We'll put a nice sterile bandage and we'll be good to go. Any other questions?
Yes, one other question from Brad once more on YouTube. I believe it's a repeat question. From the previous question, branch innervate the cervical multifidus?
The motor branch, the part that has motor fibers, is the part of the nerve that innervates the multifidus muscle.
And that is it for questions.
All right. Guys, back in 10 minutes.